Thank you, Jonas. Thank you, Seafa, for this opportunity to once more show my work and invite all the colleagues abroad to come to our courses here in Brazil at our institute in Fortaleza. It's a pleasure again to stay here and show you some of my thoughts about the treatment of such complex cases when you deal with atrophic jaws. So my name is Sormani Queiroz. A oral and maxillofacial surgeon here in Brazil. I did my residency, my master, and my PhD at the São Paulo State University here in Brazil. And then when I finished my studies, I came back to Fortaleza, my city, where I am since then. I give classes and lectures, doing my job as a professor in oral and maxillofacial surgery and dental implants. Nowadays, most of my practice is focused on edentulous jaws, full arch treatment, and remote anchorage. This is, I think, 80% of my practice today. I have a little practice on orthodontic surgery, but my practice is strong, based in full arches and dental implants, mainly these remote anchorage techniques. So I will speak to you a little bit about my philosophy of treatment and what we are doing here at our clinic, our institute in Fortaleza. So we are dealing with these cases, this type of cases for many years. These are the, I think, most challenging cases that we have in the practice of dental implants. This is a patient that has virtually no bone to the placement of the implants. So traditionally, we can work on these cases in two ways. One way of treat these cases are the grafts, using bone grafts to increase the bone volume, and so in a few months you can insert implants and treat the patient. So this is a way to treat these cases with grafts. So I did a lot of cases like this on the left with iliac crest, bone grafts, and grafts that we took from the skull, the calvario bone, and ribs, and mainly iliac crest, and then waited a time, and then we inserted the implants a few months later. For these cases, in my view, these really atrophic jaws, this is if you go to reconstruct these cases, the best bone to do it is iliac crest, because in these cases we have the bed, the receptor bed that will receive the grafts, a very low vascularized and with low cellularity. So we have to use a graft that will give us this cellularity and this vascular potential to heal in this kind of bone. And so then after we can place the implants, or we have the graftless solution. So in the last 10 years, I started to use the graftless solutions. I almost never will do a graft, either autogenous from hip or intraoral donocyte, or a bone substitute. It's very rare today to do this approach. So I'm talking about these cases, these very atrophic cases. I'm not talking about other situations in which the grafts are indicated, but in these cases of full arch, very atrophic bone with low cellularity and low vascularity. And then we migrated to do these cases to remote anchorage techniques, in which we're going to use longer implants to reach the bone with good quality to anchor the implant and to deliver a immediate load prosthesis. This is our goal, because on this approach we will have to wait months, 4 months minimum, sometimes 8 to 10 months to place the implant. So this will expedite the results with, I think, less morbidity in one single procedure, not really the needing of more procedures after placing the implant. So Professor Aparicio in 2011 published this article in which he uh, showed to us, he presented to us the saga philosophy, and it was a approach based on the anatomy of the patient. So we try to adapt the position of our implant to anatomy of the patient. So he divided the cases in Zaga 0, Zaga 1, Zaga 2, Zaga 3, or Zaga 4, depending if the implant it was more inside the sinus or more outside the sinus. So this classification help us to take a new look over the treatment of patients with full arches and allowed us to place the implant outside the sinus. We have, in these cases, we have bone in the anterior part, zone 1 and zone 2, and you don't have bone in the posterior because we have here the thematization of the maxillary sinus here, and we have this part to decides to place the implants, but not always we have bone until the zone 2. Sometimes we just have bone in zone 1. Sometimes we don't have bone in any of these parts. So this will change the way we're gonna place the implants. So we're gonna choose our anchorage technique based on the amount of bone in this zone 1 and zone 2 area. So if you have enough bone in zones 1 and 2, we can anchor the implant with All-on-4 standard, tilting the posterior implants and the anterior ones straight, and we will do a standard All-on-4. If here it's X-ray of patient that received a standard All-on-4, 2 tilted distal implants and 2 straight implants anterior, almost without cantilever here, without extension, posterior extension of the bar, and very stable results. If we just have a bone in the zone 1 between the canines, we can place 2 standard implants in this area, in zone 1, and we can place 2 zygomatic implants in the zone 2. And we will have a hybrid All-on-4 treatment. It's like this that we can see here. We placed these 2 posterior zygomatic implants and 2 standard anterior. We just have bone in the zone 1 here, and we did this anchorage, and we have this very predictable prosthesis here. And if we don't have any bone at all in zone 1 or zone 2 or zone 3, we can place 4 zygomatic implants, and we will have a zygoma quad. So this is how we can treat this patient. We have a lot of options, and all the treatment is based and in a very, very well planned case in which we're gonna use the CT scan of the patient. We will plan it on the software. After this very detailed treatment plan, we're gonna place the implants on the areas we know that it's possible to place without doing grafts and delivering a good, stable prosthesis in less than 3 days. To finish, I will show you a case where we did this, we applied these concepts, and we were able to place 4 implants and give a very stable treatment. So this is a patient that we're gonna show to you the treatment of this patient that has a very poor lip support with poor smile. So she was young, but she looked aged, and she wanted to improve her teeth and her smile. And when we see intraoral aspect with this great defect here, she used these removal processes, and this stimulates the bone resorption here. So we have really a huge defect, and she has decayed teeth and with periapical lesions here, and then we think that the best it was to extract these teeth, and we could we planned to place 4 implants on the software. I used the Blue Sky Bio software to plan these cases, and we planned to place 4 implants, and then on the Excel view here on the CT scan, we can see that the bone, it was very, very thin. The other way to treat this was with graft, but the patient, we didn't want to make grafts in this case. So you can see that we have very low height, and we didn't have a good amount of bone to place the implants, but we planned to do the osteotomy here, and this is a very important part of the treatment. To make this osteotomy will allow us to have a prosthetic space to our denture here. So we planned this with the clinical exam of the patient, and then we made this osteotomy on the software, simulated the placement of the implants. So you can see here how we're planning to place the implants, a very thin bone. So we planned to place the implants from the palatal approach. Here are the immediate result of the treatment, where we placed the 4 implants anchored on the nasal floor, and then the patient with wearing his temporary, and you can see that we improved a lot the facial aspect of the patient in a single procedure, only one surgery, immediate load prosthesis, and the patient were very, very satisfied with the results. So this is what we are offering today. In this patient was possible to place 4 implants, very stable. But in other patients, if we think that is necessary, we can go to the Zygomatic, we can go to the pterygoid implants, the transsinus implants, and etc. So we have a lot of possibilities in cases where normally we wouldn't have so many possibilities. So that's why I'm really, really passionate about this kind of techniques, and this is what we are, giving to our students, the doctors that come from so many countries to learn these techniques with us. So
okay, let's begin with the first video. Is 1 minute video, is very quickly, and I hope you enjoy this.
And definitely, I've done much more than what I've expected for the course. The course exceeded my expectations quite a lot. Now I do feel like I can operate on my own with the right support back in my home country.
My name is Dr. Ricky Sandhu, and I have come from the Gold Coast, Australia to attend Dr. Sormani's Zygomatic implants course. I have done other courses in Brazil previously, and I can tell you that this course has been the best one so far that I have done.
It was probably one of the best training programs that I have attended. I went with the intention of gaining experience and insight into a wider variety of zygoma implant surgeries, and that is exactly what I've got. I've returned home, back to Australia, back to Melbourne, and full of confidence. I've already placed a solo zygoma implant, and I couldn't have been happier with my decision to go to Brazil and to spend time with Professor Sormani. He comes very, very, very highly recommended.
Okay, in 2025, we will have the course in Brazil, in Fortaleza, and I would like to show you many things. Fortaleza is a big city, 2 million people in Fortaleza. It's a big city. We have many patients here. We can guarantee for you, we will have the patient necessary to the course in Zygomatic, All-on-4, and conventional implants. Fortaleza is the princess of kite surf. If you would like to practice sea sports, is a good place to do this. Fortaleza is very nice, many beaches, a good structure to your visit here, and we will prepare everything to you here. This is the program. Sormani, we can talk about this program now. There are many programs for you. First is Cadaver Lab. Cadaver Lab is in Barcelona, University of Barcelona. It's very interesting way to begin this experience with implants, because you can study All-on-4 and Zygomatic in cadavers. Is the best way to begin. This year, in November, we will have a course in Barcelona. If you want to go to Barcelona in November, is the opportunity. In November, we will stay with BGR, Bone Guide Regeneration, with Dr. Marcius Vinicius. In the same times, Marcius Vinicius com Bone Guide Regeneration is 5 and 6 November. And Cadaver Lab with Dr. Sormani, 7 and 8 this November. Maybe you can go to Barcelona. It's very nice. Barcelona is a big university in Europe, a great concept of university, and we have the best structure there. Well, let's talk about Fortaleza. Fortaleza, the first course is the basic. The basic is, if you are beginning, you don't do implants at this moment, is the principle for you, because you can go to the laboratory and study and make many implants in laboratory, and the end of the course you can go to surgery and make some 10 implants. Is a good way to begin the basic course. The advanced course is different. Here, I hope you are doing implants in your country. Let me tell you a story. In Europe, there are some masters. In 1 year, in master, you make 30 or 40 implants during 1 year. Here in advanced course, you will do something about 20 or 30 implants in 1 week. It's different. You can get a lot of experience, practical experience, because you are the operator. You will perform the surgeries is in real patients. This is the course advance, and you see 2 surgeries, accessories. Talk something about these courses to us, Dr. Sormani.
Yeah. So we have the Cadaver Lab. It's a course that we gave this course last year in Barcelona. It was my first time at the University of Barcelona. It's a very, very beautiful and huge facility. We have good specimens, cadaver, so all the attendees could practice the techniques. We did GBR, and we did some techniques with atrophic jaws, and so it was very, very nice. They could practice like in a real patient. It's very similar to real patient, and it was an amazing experience to give this course at that university. So all the attendees were very satisfied with the program of the course and with the practice. So they really could go to the next step, that was to make the real patients program. So some of them came to my clinic in Fortaleza, and so they could practice everything that they did on the cadavers. They did in the patients, so they were more confident, because in cadaver the things are safer. We could practice, including the complications. We can't do this in real patients, of course, but in the cadaver we could practice real the complications, and so they were very confident to make these techniques in real patients.
Fantastic. And the All-on-4 and Zygomatic is very interesting. In All-on-4, we can do 4 complete arches. In Zygomatic, you can do 4 zygomatics and 2 pterygoideals minimum. It's very interesting. Please, Sormani, talk about this course to us.
Of course. So we have these courses from basic. So to the clinic that to the doctor that wants to practice since the beginning, if he is not confident to make more advanced cases. So you have this basic course. So from this point, from the basic course, he will advance through the steps to become a master, to masterizing all the techniques. So we have the GBR course, we have the advanced course, where the patient or the doctor will apply techniques of guided bone regeneration and grafts and sinus lifting and Curie technique and urban technique and this kind of complex cases. We have an amazing professor, that is Professor Márcio Vinícius, is a great surgeon here from Brazil. He was making his training with Fuad Curie and with Urban in the clinic. So he's really a master on this field, and I am focused on teaching the All-on-4 and Zygomatic implants courses. We have real patients with very challenging cases, and we are together with the doctor planning the cases on the software, and then applying this planning on the patient. And I think it's a very nice way to learn these techniques. And what I see is that all the doctors finish the course in conditions to make their own cases when they go back to their countries.
Fantastic. Dr. Sormani is a great professor in Brazil, is the best one, and receive students all around the world every month. It's very interesting what you can do with us in Sormani Institute. Well, let's go. This is September 2023, is the first course in University of Barcelona. It's a great group. This is the Professor Manzanares, the head of the University of Barcelona in anatomy, and was very, very nice course, 3 days course, and we enjoyed and learned a lot of here. And this is the first course in November 2023 with Dr. Neil. Great friend, Dr. Neil from Melbourne, was the first one. and he make a lot of zygomatics and pterygoideus transnasals in 1 week. Was a fantastic course. After this, we received Dr. Leo Ham from Australia, Dr. Rick Sadhu from Australia too, and Dr. Hileo. Was fantastic in March and May. Was very nice course, and they make a lot of surgeries. Was fantastic. We enjoyed a lot of and make a new friends here. And now we have in 2024 complete the course to September, October, and November. In October and November, we have 2 places. If you want to come to Fortaleza this year, you can talk to us privately. In Barcelona in November. Okay, let's go. Barcelona is a great city. It's fantastic and safety one, and you have many things to do there. The Holy Family, the soccer play, Barcelona, the museums is fantastic. University of Barcelona, Department of Anatomy is fantastic. This, we have a convention with this university, and our courses will be there. Fortaleza is the best beach in Brazil. This is Jericoacoara, knowledge around the world, is in the one of the 10 most beautiful beaches in the world. Fortaleza, 2 million people live here, is a great capital in Brazil, with many beaches, and if you like kite surf, is the best place to practice kite surf. Is fantastic. The best moment is now, because you have the air ticket in the best price. You can make your reservation. We suggest always the flex air ticket, because the flex in the word, now the word is very different, is very something problem with the pandemic and something like this. Then we suggest you buy the flex ticket, air ticket. Okay, the course in Fortaleza. All courses in Fortaleza have the same model. The first day, you have theoretical classes, you have a laboratory, biomodels in the first day. The second, 3, 4, and 5 days, you have surgeries all the time. On the morning, on the afternoon, sometimes in the night. Okay, this is the course. All courses are the same way, the same model. Who wants to be a group leader? The group leader is very interesting, because our courses begin in January and finish in November. December, we don't have course. We're looking for a group leader to any month. I will talk to you about the group leader a little bit advanced. But now you have to think, when I can go to Fortaleza? Which is the best month to go to Fortaleza for me? That's the question you have to make in your mind now and get the answer, because this is important. When? Okay, what we offer? First, accommodation in 4-star hotel with breakfast includes. The hotel is on the beach. You cross the street, you are in the beach. It's a very nice hotel. Everything you need there, swimming pool, Turk sauna, everything. The air ticket and airport transfer to the hotel, limited tickets to maximum 1,050 and 500 US. Because this is important. If you go to Barcelona with executive classes, is your own. We can pay just 1,500 for your ticket to go to Barcelona. Personalized goal to surgeries. This is a grow to surgeries. I'm using one now, and we will receive one for you during the course. All necessary materials using during the courses. In the end of the course, we have a dinner and certificate presentation. A certificate is from the European Society of Facial Harmonization and, of course, for the Sormani Institute in Brazil. This is what we offer for you to all the course in Brazil. Okay, let's talk about the fee. In Europe, some courses like this, not the same, Zygomatic course for 18,000 and 1,500 for 4 days in course, when you will make one surgery and see a lot of surgeries. Just this in Europe is the price for this course. In Cadaver Lab in Barcelona is 5,500 euros. This is the price in Europe for this course. Because we are in Brazil, you have a best price, and I hope you can surprise you with the price. Let's see in Fortaleza. The basic is 9,900, is the same price to all this course. In the Zygomatic course, we have the offer for 10,800 for this course, and the Calada Lab, the 2,500 course. This is the fee for the course, but we are looking for a group leader. Let me explain you a little bit of this. During the webinar, we are looking for a group leader for 2025. As a group leader, you will have the advantage of choosing the month you want to come to Fortaleza, and you can invite your friends to join the course. Additionally, you will receive an exclusive discount of 250 USD on your registration. To secure your position as a group leader, you need to register today by paying an initial fee of 500 USD. The remaining payment will be discussed privately, with options to pay in installments via PayPal, bank transfer, or by making an initial payment now and settling the balance 10 days before the course begins. This is your chance to take the lead and shape your learning experience in 2025. Make the decision now and become a group leader. This is very important, a good opportunity to do this. And so choose the month you come into the course, invite colleagues to take part, and extra 250 USD for your sign up today. This is for today. I know many you are here, you are thinking about coming to Fortaleza, and we can guarantee for you the best condition to do this. And we are worried about everything to your trip to Fortaleza will be fantastic. That is our proposal for you. And now you have to think which month I can go to Fortaleza next year. This is the point. Publish a link. You can go to this link and buy the course, the reservation with 500 USD. Just take this offer now and enjoy this course. Enroll now. We are looking for a group leader today. 7-day guarantees. Now you can take advantage and booking now the course. And think about this week. If you are wrong and you decide to cancel, it's no problem. You have 7-day guarantee. No questions. You can buy now and stay safety. The refund policy. You have 7 days to cancel your booking. Up to 7 months before the course starts, 100% refund. Up to 6 months before the course starts, 50% refund. Less than 5 months before the course starts, no refund. But note, there is always the option to reschedule the course to a future date, ensuring that you do not lose your reservation. Because it's normal. I understand you are going to Fortaleza in 1 month before you have a big problem in your city, you can't go. Don't worry. We organize your trip to a future date and you don't lose nothing. This is very important and you have to be safety with this. Make the decision now, you have the best chance. Okay, let's go to the question. Sushan Rodilia, hi, can we do All-on-4 and pterygoidal implant placement in a course? I would like to master All-on-4 and pterygoidal first. Dr. Sormani, what do you say about this?
Yeah, that's possible, and I think that is the correct way to learn these techniques. First, we will master the All-on-4 standard techniques. So you do a course where you do the All-on-4 concept, the classical All-on-4 concept from Paulo Maló, and then we will learn the pterygoid implant, and then the transnasal and the transsinus implant. So we will master this technique. So then we will go to the next step that is to learn more complex cases and do the techniques of zygomatic implants. For example, in the patients, the hybrid zygomatic with 2 zygo and 2 standard implants, and the quad zygo sometimes on the All-on-X concept, 4 zygos and 2 pterygoids, for example. So that is the best way. So and yeah, we have this training. Like I said before, it's a step-by-step training. Some of our doctors, our colleagues that come to Fortaleza, they come here since the basic. So every year they are coming back. So we have a guy for example, from Switzerland. He began with me with the basic implants, and now he's mastering the All-on-4. And in the next step, he will come back to do the zygomatic implants course. So this step-by-step training is the best way to learn these techniques and to masterizing these techniques.
Okay, what will be the approximate cost and course structure of this type of combination? Let me explain something. Some doctors want to stay in Fortaleza more than 1 week, more than one program. If you choose one program like All-on-4, the price is that price I show you. But if you want to stay 2 weeks, we will talk about this and make a price for you stay more and make more surgeries in this program. It's not a problem. Another doctors want to make the All-on-4 course or zygomatic course and the surgeries accessories like a sinus elevator, bone regeneration guide, any one of these. We can personalize your stance here in Fortaleza. If you want to add something, Sormani.
Regarding the course, or regarding the costs, or regarding the
regarding the combination of course.
Yeah.
More than 1 week.
Yeah. The important is that the colleague do the first part of the training, that is the standard All-on-4, the standard techniques, and then he will do the second part, that is zygomatic implants. But he can do this in 2 weeks, straight weeks, for of course costs reasons, are if the doctor don't want to come many times here in Fortaleza, so we can optimize this and do this in 2 weeks. But I don't think this is the ideal, but we can do this in some cases. We did this with Dr. Hillel. Dr. Hillel stayed here, but he was training zygomatic implants, and so he wanted to stay 1 more week to masterize the zygomatic implants and also to do more cases of pterygoid implants. So we did, I think, more than 12 patients. We placed 20 pterygoid implants and more, at least 20 zygomatic implants. So it's possible to do this training in 2 weeks. But I think the ideal is the doctor can come here to do the All-on-4, and then he returns to his country and his or her country, and so he will begin to apply these techniques on the patient, on his own patients, and then he will come back when we will gain more experience with these cases. So he will come back to masterize the zygomatic implants. I think this is ideal, but we can do the course straight 2 weeks to, if the doctor wants to learn the 2 techniques in just one travel.
Okay, fantastic. There's a lot of implants you can do in Fortaleza. And now we are waiting for you. This is the price. If you combine 2 programs, is not the double. We have a better price if you stay more than 1 week in Fortaleza.
I want to ask a question to the audience, to the attendees. Could you say from which country are you in the chat? Just to me to figure out from where are you coming from. So Dr. Sushant Horila, do you use the Neodent system? Yeah, we are using the Neodent system here in Brazil. And this is good because I'm a speaker from Neodent here in Brazil, and that is interesting because you have in all countries of the world practically this system of implants. I know that Neodent is very strong right now in Australia, in the US, and in Europe. So we are using the Zygoma S, the new implant from Neodent, and so this is the brand of we are using here.
Yes, Neodent system from Australia, everybody from Italy. Well, we will organize a group from Italy with simultaneous translation to Italy. Abdallah, if you want to come here in Italian, we can organize a course in Italian too, no problem.
Okay, we are all very welcome. The course is we give the course in English. I speak English and I speak Spanish too. Abdallah, Italian. Although I have a background from my family, it's from Italy, but from Italy, but I speak some words in Italian. I think I can understand very very well the Italian, but I can't give a conversation. But we will figure out how to do that, and we can speak in English too. Okay, it will be a pleasure to receive all you here in Fortaleza. Our courses are we do it in a very relaxed environment, so we really make friends. All doctors that come here, we keep in touch after the course. I think it's the environment to learn. It's very good. It's an educational environment. So we also go to besides the education objective, we go to the restaurants. We do a part of the course. We go out with the students. So the staff on my clinic is very nice, and we would like to do the surgery. We have a good structure to go to do these procedures. And some cases that it's not possible to do on with local anesthesia, we go to the hospital. So we have these two environments in office surgeries and also in the hospital basis with general anesthesia. So it's a very complete course. Okay.
Now you have more questions. Do you cover the prosthetic part or just the surgical practice? This is we and Sormani was talking about this. Sormani, please answer to Mohit.
Okay. Look, the prosthetic part is not the main focus of this course. The course is focused on the surgical part, but mainly with complete arches, we can't separate too much the surgery and the prosthetics. So we will do the initial phase of the prosthetics. We will do the intraoral scanning or conventional impressions. So we hope that most of the cases in 2 to 3 days we can place the provisional prosthesis. So we can arrange a class regarding the prosthetic point of view of these cases. We can arrange it. We have good professors, good teachers here on this subject, so we can arrange a class about it, and we will see this initial phase, because all the cases, of course, is immediate loading. So we make the immediate loading protocols, but it's not mainly focused on the prosthetic, and to do this we should have a course with more time. So this is because we are focusing on surgical phase, but we will have a lot of information about the prosthetics too.
Okay, the colleague say about how many surgeries, how many arches in 3 days of surgeries. Vet, we have 4 days to surgery, not 3 days. The first days is in laboratory and theoretical class. The days 2, 3, 4, and 5 will be in surgery. Okay? In All-on-4, 4 arches per student. Sormani, explain to us how many arches they can do in 4 days of surgeries in All-on-4, and how many zygomatics and pterygoideus they can do in the zygomatic course.
Okay. Normally, the students will do 4 arches. What is important? We don't have 2 big groups. I don't like to have many doctors here in one single group. We prefer to do small groups where I can deliver a best course, more personal, and I can really follow the doctor doing the surgeries. So this is the best way to practice. I don't like. I did in the past. I did courses for bigger groups, so the course is not so good to the doctor. So I think to the doctor to enjoy the whole practice, it's important to have small groups. So I will stay side by side with you in every case, and so I will guide you to do the procedures, and it's I think it's far better to the learning process to the doctors. Okay, so you do 4 arches. In the zygomatic implants, I think we will place. It depends because some cases are of hybrid zygomas, like 2 zygomas and 2 conventional. In some cases, we quad zygomas. So it depends on the complexity of the cases. But normally, in 4 days, one doctor will place, I think, 8 to 10 implants in the total. Okay, which is, I think, I attended many courses in many parts of the world, and I gave courses in the world, including in Italy. I gave courses in Italy, but uh, almost all the courses, the doctors were just looking, just seeing the procedure. They were not doing the procedure really. So here, I can assure to you that you do all the procedure. So what we do is we 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 will show the case, we will plan the case with the doctor, and so he will enter in the surgery. You will work in pairs, we will work in doubles. So I will be next to you outside the surgical field, but I will be next to you. So I will just enter in the procedure if I see that have something that it's going it's not good, so I have to enter off or if the doctor asks me to show or to enter in the procedure. But the idea is that we will be the surgeon, really the surgeon. We will do, since the planning with me, I will guide you through the process, and then we will operate the patient by yourself. Of course, I will be at your side all the time, and if necessary, I will enter in the field. But really, we will do all the surgery. This is, I think, the strongest point of our course. When you saw the doctors that attended the course speaking, they speak free. They gave the statements by themselves. So they talked about this kind of possibility to train by yourself and to be really the surgeon commanding the surgery.
Okay, Vedi, I show you the date for July. It's always the 3rd week on the month. You can look for this. But if you want a date different, you talk to us and we can arrange this too. It's not a problem. Well, Sormani, you said something, I will complete. There are another courses when you make surgeries, but it's one surgery.
Mm-hmm.
Just
Yeah.
one
One
zygoma.
surgery. Yeah.
It's very few. I love the course of Institute Sormani because you can make many surgeries. This is important. I'm in your side. If I go to Australia, to Brazil, and stay 1 week over the sea, I want to make many surgeries. I don't want to make one surgery or just watch. I have to do performance the surgeries. That's the point. And we believe in this.
And I say more, Jonas, if you permit me. Yeah, we have course. We have a course here. It's a course that the public it's from foreigners too here in Brazil, and goes to the other side. Is that too many patients, too many surgery, but you know, the doctor will be by your, without guiding, without mentorship. So it's made in a complete wrong environment, in a big clinic with many surgeries at the same time. So one of the guys that came here to our course said to me, I attended this course. It's in São Paulo. So they say, it's a lot of surgeries. Yeah, it's a lot of surgeries, but without any planning, without any guidance. And so the student is by themselves. And this is not a way to teach correctly. We believe in good teaching. Uh, the doctor needs guidance. The doctor needs mentorship, but he has to make the surgery by themselves, but in a correct environment, to learn the correct way to do these cases.
Mohit is not a problem. We can talk Dr. Sormani and Dr. Marcius Vinicius and arrange this for you. It's not a problem. One point more. I suggest always to everybody to invite someone to make your couple, because when you are doing Zygomatic, it's good you do this with a team. It's not alone. It's good one. Then, if you are beginning in the surgeries in All-on-4, invite a colleague to make the course with you. This point, you are beginning to organize your team in your country. It's very important. Okay, we are finished the presentation. I have one more video. I would like to show you the video with Dr. Neil, the first student in Fortaleza. Is a very good video. Let me see.
Just before the videos, I want to say one more thing to the doctors, which is important. We will keep in touch after the course. I have been in touch with Dr. Neil, Dr. Lilham, and Dr. Hilo, and all the other guys that came here. I said that because after when they have their own cases, they always ask me about the planning and tips to do the procedure. So we give you after the course this kind of mentorship through your own cases when you go back to to your country. So the course doesn't end when we leave Fortaleza. We will keep in touch, and I will be, if you want, your mentor throughout your journey, your clinical journey. To me, it's a great pleasure. The thing I like the most in my life, there are two things besides my family, of course, but I love to operate, and I love surgery, and I love to teach, to give classes, and to pass all my knowledge to the future generation. So this is, my legacy through to the dentistry. Okay.
Okay, Mohit, the question: what if someone wants to cadaver first and then the live All-on-4 on the same trip? I think it's not possible, because the cadaver lab is not in Fortaleza, is in Barcelona. There are two trips. The cadaver lab we make one time, one per year, is in November. If you want to come to Barcelona in November, then you can make the cadaver lab. If you want, in the same trip, go to Fortaleza to make All-on-4, it's possible, because the cadaver lab is in the first week in November, and then you take the trip to Fortaleza in the next week, in day 11, you have the All-on-4 course. It's possible if you go to Fortaleza, to Barcelona, and after you go to Fortaleza in the same month. because it's just one per month, the cadaver lab. Okay? And the video, I will show you the video from the cadaver lab. Look.
Today, in the 21st century, knowledge is humanity's most valuable treasure. And discovering the secrets of zygomatic implants in this sacred place of learning, the University of Barcelona, is a journey that challenges the mind. Here, between these walls, knowledge manifests itself in a visceral way. The dissection of cadavers becomes a portal to a profound understanding of human anatomy. It's one of the most impactful hands-on learning experiences anyone can have. But remember, there are no easy solutions to complex problems. The journey of knowledge is a steep climb, but the rewards are priceless. Many thanks to all the students who trusted us with this incredible experience.
So hello, we are here again, now with Neil. So Neil, our second surgery of the day, it's the end of the day, we're tired, but I think we are very excited because it was a very beautiful surgery.
Oh, yeah.
What was your impressions about the second surgery?
The second surgery was much confident, and everything went on smoothly. Even before attending to the patient, Dr. Sormani had discussed CBCT, and we planned how the procedure is going to be, and it was straightforward. And we were able to place 2 standard implants in the anterior area and 2 zygomatic implants on both sides, the left and right. And what I was really happy was there was absolutely no tear to the Schneiderian membrane.
Yeah.
And that is what I really liked.
Yeah.
And it was a pretty clean surgery.
I must say that I'm really happy with you just made, because you showed me that you understood everything that you saw on the theoretical classes, and watching all the surgeries, and learning with us, with me, and with Dr. Eduardo, Dr. Gustavo, and Dr. Lécio, and Dr. Milton. Everything that we passed to you, you absorbed, and this surgery, it was at the end of this week, and I am very happy of how much you learned, because as I told you, you're gonna do this surgery from the beginning to the end, and you did all the surgery from the beginning to the end. And the position of the implants were so amazing. It was exactly like we planned on the CBCT.
Yes.
And as you told, you did the approach to the sinus.
Yes. There was no rupture.
And you detached the membrane, and no disruption of the membrane. It was a clean surgery from the beginning to the end.
Yes, because you mentioned, and we saw in the CBCT, that the patient had sinusitis, and Dr. Sormani said it would be best if we don't perforate, and I was always mindful of that, and we did without perforation.
On the CBCT, we saw that the patient has a past of
chronic sinusitis.
She's not with symptoms now, but I told you that it would be very important to don't tear the membrane, to maintain the membrane intact. So you could do that, and at the end it was a very clean surgery, very beautiful surgery, and you could see the difference between the first case that was a reoperation. It was a case of reoperation where we have to took off 2 implants, and this case that was a case that we planned exactly how it would be, and it's quite different, no?
Definitely. I mean, I before I came here a month back, I could never think that I would be able to do a surgery like this, zygomatic implants. But I'm confident of placing zygomatic implants myself, but of course I'll be being in touch with you for your guidance. I need your guidance throughout my journey on zygomatic implants.
I hope you'll come back in the future to do more cases.
Yes.
And to improve and begin to make more complicated cases, quad zygoma and etc. But I'm pretty sure that you go back to Australia, we'll be able to make these cases following this philosophy. I told you that this philosophy that we do here, it's absolutely reproducible.
Yeah,
you can do that
absolutely
in a safe way. So I'm happy with.
And that tool that we used, the Zaga retractor.
Yeah.
Amazing.
Yeah.
I liked it.
Yes,
I liked it. We were able to view the zygomatic bone clearly.
Yeah.
I
will pass you the seller, the address of the seller.
Yeah.
So I'm happy.
Yeah.
It's the end of a journey.
Yes.
A beginning of another one.
Yeah, another one. True. And I'd like to thank the entire team from Dr. Jonas to Dr. Sormani, Eduardo, Gustavo, and all my 10 colleagues who were in the course, and also the two doctors that we...
Dr. Alessio, Dr.
Newton. I thank you all, and you made it happen, and I really wish you the best, and I'll extend my full cooperation to you guys.
Okay, thank you.
Okay. Sormani, I'm happy with this. I hope you can enjoy with us. You can enjoy your friends, your colleagues to go to Fortaleza or go to Barcelona. Is a pleasure to us. You have to think we will do the best for you, and we will pay attention in everything. The hotel, your transfer, when you arrive in Fortaleza, there will be one person there, a chauffeur, waiting for you, take you and go to the hotel. You don't think you don't have any problem in Fortaleza. Fortaleza is a very safety place in Brazil. It's a big city. All big cities have problems. Fortaleza is not different, but we know where you can go in Fortaleza without any kind of problem. Now, trust me, trust us, we are doing the best for you. And thank you so much for your patience to listen everybody wherever we talk to you. And Sormani, I give to you the word to say bye-bye.
So thank you, Jonas, one more time for this opportunity. Thank you, everyone that were with us all the time, and we are ending this meeting now. So I want to welcome every one of you here in Fortaleza. I hope to see you very soon, and we will really enjoy. We are committed to give you the best educational experience possible. Thank you very much.
Thank you so much. Bye-bye to everybody. Have a nice day. And I hope see you in Fortaleza or in Barcelona. Bye-bye.